Tom. Health officials from the federal to the state level are confident we will have a COVID-19 vaccine approved by the end of the year. Now, to prepare, health departments across the state are working on plans for a quick rollout that's expected to follow.
They're still working with a lot of unknowns, though. Kent County's top health officer says Michigan could get between 84 and 200,000 doses, but they don't know how many of those will end up in West Michigan. We know you may still have questions about this vaccine as it gets closer to reality.
Questions like, what's the process once you get it? How long does it take for it to become effective? Are there side effects to it?
News 8's John Dom will talk to a medical professional to try and get those answers.
The Pfizer and Moderna vaccines use new messenger RNA technology that's never been used in humans before, and it's set to become a new landmark achievement in the field of medicine.
I would consider, messenger RNA technology for vaccines to be a huge game changer in vaccine technology.
The advancements necessary to make this type of vaccine possible only existed in the last few years, and the side effects aren't expected to be much different than what we've seen in the past. Temporary arm pain and maybe a minor fever.
Because it releases chemicals, and those chemicals that the immune system releases is what gives you those symptoms. They usually go away within 24 to 48 hours, and they are rarely, if ever, very serious.
The FDA says Pfizer's COVID-19 vaccine is safe and effective after just one dose, but the Moderna vaccine requires 2 shots, spaced apart, that second shot acting as an immunity booster. And it will start keeping you safe from the virus quickly.
People still had a pretty good level of protection from it. They didn't get severely ill. And that it was, the vaccine should start to work right away. It's just that it ideally needs 2 injections, that booster shot, to really provide the optimum amount of protection.
The doctor has heard of people trying to shake public confidence in the vaccines, saying this new mRNA technology is unsafe. Claims that he says are both worrying and unfounded.
Unless human beings have gone through some miraculous genetic evolution where we have developed the ability to make DNA from RNA, that is completely impossible to happen. So anybody who is peddling that this is going to change our genetic makeup, that is completely false and flies in the face of what we know about human genetics.
Before a drug gets FDA approval, it also has to get approved from an outside panel to ensure it's met every safety standard.
They are not going to allow this to be used in human subjects unless it's safe. And I think that everything right now points towards it being very safe. And I think that is going to continue to be the case even after we deploy it into the population.
He told me that he fully expects both vaccines to get approved in the United States within the next couple of weeks. Reporting in Grand Rapids, John Dommel, News 8.